And you'll be able to turn the camera around?
Yep.
Okay, great. We're speaking.
Perfect. Hi everyone. So we are officially starting our event today. It's around 12 o'clock to 21. Sorry for the delay because of all the issues that's happening around with the road building and stuff here. So yeah. So this is the event on indigenous medicine in global health positioning, for the rights and the safety of the safeguarding the knowledge about indigenous and traditional knowledge that is being for the future generations. So we wanted to make sure that the indigenous medicinal knowledge should be kept in this main framework of WHO properly, and also without getting any kind of backlash or any kind of issues regarding that. So that's the main goal of this event, and we want to discuss about how we can make this knowledge being kept in this main space without any issues. So we were looking for our main first speaker, who was our Geoffrey, who was our keynote speaker, to speak about what is indigenous knowledge and how the knowledge should be kept. So we have some yes, can't hear you. Oh, sorry. So some of our speakers. Can you hear me now? Hello. Hello. Can you hear me now? Okay, perfect. Okay, I need to be at this place then. Okay, this is not working. Some technical issues, I think so. Perfect. So let's go ahead. Can you hear me now? Yeah, that's
Somebody
working.
needs to turn theirs off.
Audio.
Yeah, I'm not connected.
Okay, perfect. So hopefully you guys can hear me now, and let's go ahead with the session today. Uh, yeah, I would like to, since Jeffrey is not here, I would like to give the floor to Christina to just brief us about what is happening on traditional and indigenous knowledge right now. So,
Do I need the microphone?
yeah, I'll just put it over there. Just a minute.
Do you want me to call Jeffrey on the phone? Not WhatsApp, in case he's off of Wi-Fi. You might think he's with the camera. If he's driving.
But it should be this.
If you don't, use driving then.
Yeah.
Thank you so much. Thank you so much, Gokul. It is wonderful to meet you. To be here with you. You know, I'd like to begin by thanking you, for the vision of bringing us together in this important dialogue, and right during the World Health Assembly. And at a moment when, discussions on health systems, equity, resilience, and indigenous health are becoming increasingly important at WHO. I also want to acknowledge the Indigenous peoples and representatives that are present here today in this room, that are on this panel online, and really recognize the importance of Indigenous voices and leadership in discussions on traditional and Indigenous medicine. So a little bit on what we've been working on within WHO, with Indigenous peoples at the intersection of biodiversity, health, traditional knowledge systems, including traditional medicine. So we have been working on this at this intersection for over 15 years through the Joint Work Program on Biodiversity and Health with the Convention on Biological Diversity. And, I think it's important to say that while no international or UN mechanism is actually perfect, the Convention on Biological Diversity, or CBD as I'll be referring to it from here on, and has actually provided a very unique space over many years for dialogue and engagement with Indigenous peoples and traditional knowledge holders, including through what we call Article 8J, which is on traditional knowledge systems, and broader discussions related to traditional knowledge, participation, and benefit sharing, for instance, under the Nagoya Protocol. And WHO's partnership with the CBD and other UN agencies has also very much informed and learned from that engagement with Indigenous peoples and our collaborative work in this area. As you may know, and as some of the people online may also know, we've also developed a new traditional medicine strategy that was adopted at the 78th World Health Assembly. It's the 2025 to 2024 34, so it's 10-year traditional medicine strategy, and it really also takes into account how traditional, integrative, and complementary medicine can be strengthened and how it can help us to achieve universal healthcare access and the Sustainable Development Goals. And it also recognizes how Indigenous peoples and their rights can be integrated in traditional medicine through appropriate legislation, funding, and fair engagement with member states in their national context. But at the same time, beyond that relationship with states, through our work with the Global Traditional Medicine Center and the WHO Department on Environment, Climate Change, One Health, and Migration, we have been working on different frameworks and tools that really recognize Indigenous peoples as rights holders, how to really respect those rights of self-determination and ensure that Indigenous people's agency and leadership is really present throughout the whole process. And just to give a little bit of background, for those that aren't aware, in 2023, WHO established the Global Center for Traditional Medicine and held the following year the first global summit on traditional medicine, out of which came something that is called the Gujarat Declaration. Within the Gujarat Declaration, there was a new pillar that was established on biodiversity, Indigenous peoples, and traditional knowledge systems. And the idea is recognizing that holistic view of health that Indigenous peoples hold, and noting that these things are actually indivisible. And that's where I think that new element of real novelty, comes in terms of how we are working across these issues within the WHO. And since then, that process has been very intentionally participatory and very closely informed by dialogue with Indigenous peoples and representatives across all 7 sociocultural regions. So that in itself is actually a novelty for WHO. WHO tends to work within its own 6 regional subdivisions. And in thinking about how we are working on Indigenous knowledge systems, Indigenous medicine, we said, well, Indigenous peoples have different subdivisions in which there are 7 sociocultural regions that have been recognized by the UN Permanent Forum on Indigenous Issues. And it makes a lot more sense culturally to use those to create new spaces for dialogue and for co-creation. So, and through that, we have created the first draft WHO framework on respectful engagement with Indigenous peoples on biodiversity, health, and traditional knowledge systems, which also very much speaks to Indigenous traditional medicine, which is the topic that we're discussing here today. And in that space, I really want to acknowledge, the important contributions of many people that are on this panel. For instance, Jeffrey Roth, which hopefully we will hear from very soon, Emma Rawson, of course, Rodrigo Payalev, who is also in this room, and very importantly, also the DOCIP, which we have here with us today. But also a much larger group of Indigenous peoples across the 7 sociocultural regions. And just to give you a tiny bit of background, the objective of the framework isn't to standardize Indigenous knowledge systems or to subsume them in any way into biomedical frameworks, but really to support that ethical and equitable engagement, to strengthen that intercultural dialogue and mutual learning, improve those safeguards, that accountability, that transparency, and to support our institutions in working in a way that is much more responsible and respectful of Indigenous rights and with Indigenous peoples. And that is foundational to ensuring that we respect the true value of traditional knowledge systems and traditional medicine when we are working across different knowledge systems with biomedical health. So I think there really is that growing recognition that healthy ecosystems, that biodiversity, that climate change, that the indigenous determinants of health are deeply connected intrinsically with long-term human health, with resilience, with well-being in ways that increasingly resonate with Indigenous understandings of health and its determinants. And maybe just to close, because I think I'm way past my 5 minutes, I think that fundamentally working on traditional and Indigenous medicine really requires that humility within UN agencies, really requires that openness to other systems of learning, to other systems of knowledge, to other methodologies, and the recognition that this has to remain a continuous process of mutual engagement, of trust building, of shared and mutual learning, one in which no knowledge system is actually perceived or understood as inherently superior to another. And it also requires acknowledging, we have to, right? We have to acknowledge our failures if we're going to improve, that globally, and I'm not speaking for WHO, I'm speaking at a global level, those deeply embedded colonial structures have really profoundly influenced the health outcomes of Indigenous peoples, and that we absolutely have to continue creating new spaces for more respectful dialogue, for more ethical engagement, and for very genuine partnership. And that's exactly what we're trying to do through the WHO framework for respectful engagement with Indigenous peoples, which we very much hope can help to inform the important global plan of action on Indigenous peoples, which is currently under development and under discussion. Of course, within WHO, we are trying to work together, and hopefully it will be adopted next year. So I'll leave it there for now, and looking forward to the discussion and to the mutual learning around this table.
Thank you so much.
Thank you.
Thank you. Thank you so much, Christina, for making that statement. It was really powerful, and it was like an eye opener for most of the people here, because this is a topic that is not even spoken a lot, and also not in the table too much. So thank you so much. And for the future, we wanted to include more Indigenous voices. Where I come from India, it's there's a lot of Indigenous traditional medicinal healers and also doctors who study traditional medicine, like Ayush. Ayush is not traditional medicine, but it's Ayush is traditional medicine, but not Indigenous medicine.
Yes.
So that is a difference. So, but the basic thing is that both of them have the similar science from different regions.
Exactly.
If I go to Australia, it is Indigenous medicine. If I go to India, it's traditional medicine. So that's a linkage between that we need to find, and it's really important for all of us to come together, sit together, and create this framework. Thank you so much, Christina, for making this statement and being the opener for this event. And I would like to go to the next session, where it is a panel discussion between our panel speakers, who is Rodrigo. Rodrigo is one of the vice chairs of the UNPFII, United Nations Permanent Forum.
Indigenous issues.
Yeah, indigenous issues, and also we have Rami from DOCIP, who is working in indigenous knowledge systems for a long time, and he's been around in this and been working on with the statements with Christina as well. And we have Emma, who has not yet reached.
She's on her way.
She's on her way. Mostly she'll be here. She's the president of FPHA. It's one of the non-state actors of WHO and working on public health. And she's also an indigenous person who is the president of the organization. So also we have Hans Erling from Norway. He's a BDS doctor and also representing Tunsberg Medicinal School, which is also promoting indigenous and traditional medicine. So thank you so much for every one of our speaker here. Sorry if I'm not saying a lot about your work because of the time frame, and also want to give the floor to everyone and make sure this session is really important for everyone. Have a good outcome as well. So as right now, I will be handing over this to Rodrigo for his input on framework. Okay, so from the perspective, what legal and governance elements are essential to ensure that implementation of the draft WHO framework on respectful engagement with indigenous people remains genuinely right-based and indigenous-led. Okay, I'll just put this over there. Perfect.
Okay, Gokul, thanks for your introduction, for your kind introduction. I'm a member of the Permanent Forum, as Gokul says. I belong to Mapuche people from Chile. I'm indigenous also. Hello, everyone, by the way. As you can see, my English is not good. I'm going to try my best.
It's good. It's actually good. It's
until here. If I make some mistake, Christina, correct me, because we are working a lot of time in this framework, and she knows perfectly that I would like to say in this meeting. Okay. Thank you, Gokul, again. And we are working for a long time in this framework, around 2 years. It's too long. Before answering, I would like to provide some context or some important points. Indigenous peoples are rights holders and equal partners, not beneficiaries or stakeholders. This is a very important point because always we have problem with that. Building bridges does not mean assimilating indigenous knowledge system into dominant framework. It means recognize indigenous knowledge and medicine is as equal to Western medicine.
Yes, it's good. It's good.
Yes. Okay. Respect for self-determination and indigenous leaderships. Free, prior and informed consent is essential in all engagement process, and free, prior and informed consent takes time because indigenous people have to consult with their communities always. That process usually is not easy. Frequently. Respect for indigenous governance system and community protocols is necessary. It is also important protection traditional knowledge from exploitation, not authorized extraction, and so recognize that some knowledge is secret or sacred. It's not the same. We received and we are still receiving the comments of and view of indigenous people in this framework. As Christina explained, we are in a process to the last step to have finally our framework, and we hope we working in co-design because it's between indigenous people and WHO in a long process, as I said. Implementation, we are hoping, monitoring and decision making, equitable and respectful partnership with indigenous people, accountability and transparency, and implementation processes. Intercultural dialogue based on mutual respect and reciprocity. And also recognize that indigenous health is deeply connected to land, territories, biodiversity, culture, languages, spiritually, and community well-being. ¿Cómo se dice un todo?
It's a whole.
It's a whole. Thank you. To do this work, we need, it's our point of view as indigenous, because the point of view of indigenous in these issues are similar or equal around the world. I'm in contact permanent with indigenous of 7 sociocultural regions. That's the reason I know that. We need building respectful bridges between indigenous knowledge system, WHO, governments, and global institutions. For this, we need time, as I said previously, and resources. Time, because we need a lot of time for our governance processes, for our internal deliberation processes. And resource, because these are essential to enable the effective and influential participation of indigenous people in decision making. Other stuff, the political will of each government is also essential to move from symbolic consultation toward genuine partnership and co-governance. And for this, intercultural dialogue is completely necessary also mutual respect, reciprocity, equity, and recognition of different worldviews and traditional knowledge as equally valid. Christina says the other way, but the same as I'm saying. United Nations agencies and partners must work on trust building always. No, not sometimes, always. It's a long process to building this relation. This is essential and requires long-term engagement. It's not about one meeting or some week or even some years. It's forever and ever. We need transparency, accountability, flexibility, and pragmatism, and continuous indigenous participation. This is very important, continuous, because the legal instrument international about of consent and consultation, but that processes happen in one moment, and we need to, that processes always happening. No sé si está bien dicho.
Sí.
We know it's not easy, but it's absolutely necessary. Okay, but we are so here to learning, and I would like hear you your point of view. So thank you so much. Thank you.
Thank you so much, Rodrigo, for making that statement. It was really informative on how indigenous knowledge is important and how the engagement is happening right now. So that's the status update of how indigenous people are on this framework right now. As you can see, the main things on this will be like it's still happening right now in a framework of like the creation of the framework and the like how can this be integrated towards the global health framework so that we can have a universal, like a better universal health coverage, and also get more health health benefits out of the traditional and indigenous knowledge for everyone in the world and share the knowledge across from different countries. So I would like to say something from, because I didn't say who I am, who I'm here, why I'm here. So I'm Gokul and I'm a BMS Ayurveda medical student, final year, and doing my bachelor's right now. And I'm still here because I had a project that we were building, which is called as Govardhan. It's like the world's first social media for biodiversity. So it is like we have this particular innovative idea where we transfer information of how people are using plants and like cultural use of plants and animals from one country to another. So that we came across this issue of indigenous and traditional medicinal problems that we can face in the future. So that's what we started researching, and then we got involved with the WHO, and then all this
Yeah.
indigenous communities came in, and that is what we makes this really interesting for us. And as a traditional medicine viewpoint practitioner, and also like not practitioner yet, but hopefully in the future. So for us, the viewpoint is like really important for us, because making our Ayurveda globally as well can also create an issue for indigenous medicine,
Right.
because
Right.
it's a similar thing. So we want to make sure that it is shared, and also indigenous people are protected from their knowledge as
Yes.
well. So I had like a question to one of our panelists here. Like, have you seen the situation of yoga actually, so which has been shared across, and the value out of this, which is like the knowledge has been shared, and the value of the yoga thing, like which who is making the most money about the money from the yoga part. So which has been the Indian people or any other communities outside. So is it something that you guys are looking into, or if in the future has a plan to look into? So
Well, I don't know how closely I can speak to yoga specifically, but I think this is a very important question, Gokul. I think also, I just want to say that the work that you're doing, I think, is very interesting and innovative. And I'm always very excited when I hear, people working on biodiversity and traditional knowledge systems at the same time. So this is very welcome. But I think that it raises some important questions about whether it be yoga, whether it be other forms of traditional medicine, or a traditional complementary and integrative medicine, sorry, in this particular case. And I think that's where that mutual learning and the rights-based frameworks need to stay very present and prominent, because what happens is that we have to avoid, regardless of the of the traditional medicine system, we have to avoid anything that is extractive. So I think this comes back to one of the points that Rodrigo was raising before, the importance of those right-based approaches, the importance of accountability mechanisms, I think is really important as well. And that benefit sharing. I mentioned very briefly and in passing, and this would certainly be relevant to the app that you're developing, which is on biodiversity and traditional knowledge systems, for instance. So that those benefit sharing mechanisms that have taken years and years and years to negotiate, they're not perfect. If we're looking at the Nagoya Protocol, if we're looking at the treaty that has been agreed over a 20-year period following a 20-year discussion under the WIPO, those have been very slow in coming, and there are very small gains that are being made through those, but I think they're very significant, because it's about what you were talking about, who is benefiting, right? And so that's where those rights-based approaches become so fundamentally important, because you have to really think about what is an equitable system of benefit sharing. And within that system, since we're talking about Indigenous medicine here today, within that system, how do rights holders really benefit? And to have a serious conversation about that, you not only need to understand what those legal instruments entail, but have to have that continuous dialogue that we've been talking about, and have to have that continuous iteration with Indigenous peoples directly. And that's where that tokenistic, that tokenistic participation can't happen. That's where we have to break and dismantle those barriers. So yes, and that's where that mutual learning also comes in. Yoga is huge, right? Internationally. And it's right for you to ask the question, who is really benefiting from these systems now? Because it's actually a very, internationally recognized practice that has very established benefits to health and well-being. But then we really have to think across and find accountability mechanisms, benefit sharing mechanisms that are much more fair and equitable in that regard. So that's a very valid and important question. Thank you, Gokul.
Thank you so much, Christina, for sharing that insight, because yoga is like a traditional medicine thing. So it is like something, as we told, like traditional medicine and indigenous knowledge is similar. So that's why we took this as a case for the to share it here. So going forward, I was looking forward for Emma. She is not.
She'll be here soon.
She's
on her way.
She's on her way. Okay, perfect. Yeah, sure.
Please.
Hi, welcome
Yeah.
to Emma. I'm Summer Finlay. I'm a from Australia. I'm actually chair of the Indigenous Working Group.
Online.
Hi.
Can you start the intro again?
Yep. So hi, my name's Summer Finlay. I'm a Yorta woman. So that I'm an Indigenous woman from Australia. My country, if you're familiar with Australian geography, is down on the New South Wales Victorian border. I wear a number of hats. So one of the hats that I wear is as chair of the Indigenous Working Group for the World Federation of Public Health Associations. I'm also an academic at the University of Wollongong, an associate professor in Indigenous health. So also on our National Public Health Association board as the vice president. So I wear a number of hats. Anyway, one of the questions I wanted to ask, and again, the things you're talking about in terms of engagement is fabulous, and I'm really looking forward to seeing that. But one of the challenges that we face, particularly in a country like Australia, which where the East Coast in particular has been heavily colonised,
Yes.
and early, and we often find that our knowledges are actually held by universities, etc. And so we're doing a lot of nation building within our country at the moment, where people are reclaiming practices and knowledges. So we've never lost our culture, but parts of it have been unable to be practiced, etc. So we actually have institutions in our country. I did a workshop for the Commonwealth Government on the cultural determinants of health down in Tasmania, and they talked about how the University of Tasmania actually has more knowledge about some aspects of culture and practices and health because of the research that's been had there. So I wonder, in terms of when we're thinking about this work, we're looking at obviously maintaining and protecting Indigenous knowledges as they are, but also the reclamation of Indigenous knowledges back from institutions, because often when you've got early mortality, you've had families that have been disrupted, stolen generation, etc. Knowledge systems have been disrupted, and it's our birthright, our heritage. So, in also thinking about the reclamation of our knowledges too. Anyway,
I don't know if they can hear me online, but I have a very loud, so. No, I think the answer is actually in your question. Thank you for being here and for sharing that question, because it's not something that we often think about. Oh, I'm looking here, I guess, because these are our colleagues online. I'd prefer to, I'm just going to move it so I can look at the speaker rather than looking at the screen. It just feels unnatural. So, no, I think the answer is in your question. I think the reclamation of traditional knowledge systems is not something that we've fully done within WHO. One of the things that we have done and are recognizing very vividly is as mentioned before, that there is a very deep colonization process that has had, incalculable impacts on the health of Indigenous peoples. And we have an understanding that there is an absolute need to dismantle those systems. And I think that the only way to meaningfully do that is to really create those partnerships that are with people, Indigenous-led partnerships, not just partnerships with universities. It's important that you talk about a lot of that knowledge is within universities, but how much of that knowledge within universities is actually held by Indigenous peoples? And I think that structural change needs to happen. Not all of it can be catalyzed by WHO for sure, but those partnerships, I think, play a very important role in making that happen. But before we make that happen, we have to have that recognition. We have to say a lot of the methodologies that we're using within universities aren't necessarily appropriate to examine Indigenous medicine, to examine Indigenous health outcomes. So we have to be open and ready to work outside of those knowledge systems and recognize that traditional knowledge systems and the very important outcomes of that are held by Indigenous peoples, and we have to find ways of working equitably across them. So in any case, this is a very important question, and I'm taking note so that we could also maybe find a way to reflect that in the WHO draft WHO framework, because this is a very important point.
That's what I was thinking. Like, we don't expect you to go to every university and do the work, but just
Yeah.
acknowledge that some of our knowledge
Yeah,
is
that I
are
can.
actually being held because they consider it their intellectual property, which is challenging.
Exactly, precisely. So that then again, that intellectual property that you just referred to right now, that's where those benefit sharing mechanisms come right back in, right? And
Retrospectively, yeah.
yeah,
Because we always talk prospectively. So all of the work that I've seen is prospective rather than retrospective. And we've seen a repatriation, say, people of bodies
yes,
being repatriated to communities, particularly from significant museums in the UK. But what we haven't seen is a reclamation of other knowledges.
precisely. Thank you. Thank you for raising those points, and I've taken good note. I will consider this a peer review comment for the draft framework. Thank you.
Thank you so much for that really key insightful thing. So now going on through that, so I want to just ask one of our next panelists, which is Remy from DOCIP, on as they have been involved in many of the indigenous and traditional knowledge events and all that stuff. So I wanted to just ask you about like how is the engagement within the indigenous communities, and also how are these people aware, the elders aware, and also for us when she just mentioned about the knowledge in universities that which has an IP. For us, we in India it's like nothing, and we cannot mention something like that. We have never heard of that. Like in the case of indigenous people coming into this framework. So I'm giving the stage for floor to you to mention about how effective the involvement of indigenous people is there in this global talks and all. Yeah.
Hi everybody, so my name is Remy and I'm the director of DOCIP. So first we welcome you here. It's our documentation center, and so behind you, for those who are in front of me, you have like the statements that were made by indigenous peoples before the UN for the past 40 years or more.
Oh, wow.
So we are the custodians of this treasure. Where you see it's a bit of a mess, but we are working on reorganizing this and making it more accessible, especially online, because not everybody can come here and consult the documents. Most of them are online, but yeah, we're still working on this, and it's an ongoing process. So our role as an organization for the past 48 years is to support indigenous peoples in the defense of their rights. So it's important to mention. Are you here? So it's important to mention that we're not doing advocacy ourselves, because it would be denying the FPICs, because we are not the right holders, and we are just here to support indigenous peoples in their own advocacy. So bringing more technical support, like facilitating this kind of meetings, side events, bringing interpretation, translation. We also work on the caucuses before the main conferences. We're present in the UN main conferences about indigenous people's rights, and we also do training, etc. So and we also disseminate information, because I think it was part of the question by Gokul, is how the info is disseminated, and it's true that there's a lot of things happening on the indigenous people's rights, and sometimes it's a bit difficult to have, a clear view on because there are many processes, not only on health, but climate change, biodiversity. So we try to be used by indigenous delegates as a hub. We have our weekly newsletter, which I advise you to subscribe to, where we share all the information that we get, that indigenous delegates are aware and know what are the advocacy opportunities for them. So yeah, this is our role as an organization. An important point is the issue of languages, obviously, because we're in at the international level, we're in a mostly English-speaking world, and there are lots of indigenous peoples that do not speak English. We mainly work in 4 languages, so English, Spanish, French, and Russian. We're adding more and more Portuguese because we have more and more Brazil-based indigenous peoples coming to the international forum. Even if Portuguese is not an official UN language, but at least for the preparatory caucuses, we introduced Portuguese these last years. So it's something that is very important, so that the access is granted to most peoples. You asked also how to work with indigenous peoples. It's a long way. So the organization is 48 years old. So it was a long process to build trust. We were founded by indigenous peoples, in fact, that came here in Geneva in 1977 because they were lacking support, local support. So we were funded partly by indigenous peoples, but then the trust has to be built. And it's not like it will come on one day. It's an everyday work and attitude, meaning that you have always to keep in mind that FPIC in all the things that you do is crucial. You should never assume that you know something, you know the answer. No, you don't know. You have to ask and obtain consent. And sometimes you're very surprised because things that may look for you very casual or they are not. They're meaningful for people, and then you have to ask them and understand what they want, and I never assume that you have the answer. And so this is what we try to do, and on an everyday basis, and that this trust has been built, and it's our main asset, I would say, as an organization, is that we have the trust from indigenous delegates. And it's very important for us, and so that's how I would say about the elders. I would say that it's also an issue because now most of the communication is made electronically, and not all elders are very familiar with the modern communication style, etc. But I guess it can go through the youth as well because they're very connected, and they have to play they do play their role as a transmission with elders. But I know it's an important issue as well that elders are consulted because they're in most of the indigenous communities. They're
what do you think their viewpoint of the world be like from the elders' perspective? What will be their viewpoint of the world like? Okay, they will trust the pharmaceutical companies or like any other organization that wanted their knowledge. What would be that?
So as I said, I don't want to speak on behalf of anybody. So I don't assume that they have. We should ask them because they're the one who should speak. But I think they should follow carefully what is happening, obviously, because it involves a lot for them and their communities.
Okay. Thank you so much for that intervention. It was really nice to have that.
Thank you for your work.
Exactly.
This is the work that they have been a treasureful work of a lot of information inputs from different different events and different indigenous communities across the globe. So we have Emma finally here. So welcome to the event.
Thank you. Kia ora. Hello, Robert.
Okay.
Found it.
Sorry for that.
Created an event.
So I would like to ask you, like, what will the role of the indigenous medicine in, like, indigenous medicine in the mainstream healthcare systems? How can indigenous medicine be placed in the mainstream? Because you're already a part of the public health, so this is something like really important for us from who is working on traditional medicine also, to know how can this be kept here.
Thank you for the question. And well, just in the first instance, tēnā koutou, tēnā tātou katoa, ko Ngāti Ranginui, Ngāi Te Rangi Raukawa me Ngāti Haua, ko Ima Waimari Ross and Te Patu tōku ingoa. So I've just said hello in my language, Te Reo Māori from Aotearoa, New Zealand, and my tribal affiliations, which are 4 different tribes from the North Island of New Zealand. So that's a brief kia ora, hello in my language. Thank you for having me. I'm so sorry I was late. But I'm sure, my colleague Summer down the end has probably contributed at some point through the conversation. So it's nice to have her here as well from the Oceania. But yes, to your question, how does traditional medicine or Indigenous medicine play a role in the health system, health service delivery, all of those things? Yes, good. Well, it's multifaceted, I think, because I think the first thing that I think of when you ask that question is how appropriate is it for it to fit inside a Western health service system, and then what needs to happen in order for what we talk about a lot is the options of choice for different people to have access to the services that suit them best. So that's the first place my brain goes to, is one of the major things our people face is the lack of choice to access our own ways of healing, our own ways of medicine, and then also within Western systems, what does it look like to see those acknowledged, adopted and respected in the way that they should be alongside Western medicine within the Western biomedical system. So there's a number of things that I think in terms of its role as demonstrating the history and the knowledges of people that have been here for millennia and how important and effective those knowledges are. There's also the role of the reclamation of culture and practice, and the way in which we spiritually understand medicine and the delivery of medicine, and also, again, our choice to have particular practices around that use of that medicine and the sharing of that medicine, whatever that means, if we're thinking about intellectual property and or the monetization of the properties of the medicines that we use. And then there's the conversation around how that works as food within also our traditional culture, the role of medicine as food and that type of conversation. And then there's the thing that's really important, which I guess I'm touching on really, is how are we respecting, and I've heard the gentleman, sorry, I don't know your name, I was just speaking, but how you were really carefully thinking about respecting the knowledges that are put down in front of you, the gifts that are our medicines, because essentially that's what's happening. There's the choice for our people to practice and live the way we choose with the medicines that we know we want to be able to access, and then there's how other people want to access our medicines, and how we need to be really mindful, protective, and honouring of those things that other people want and that other people need to feel that way about. I can't stop there.
Great. Terrific.
Do Rami have a reply for that? How do you respond? Okay. So thank you so much for that intervention. It was really, really insightful, and how we can put it together.
It's the one.
Okay, great.
So thank you, Emma. So it was really insightful on how we should share this with the world, because Indigenous medicine is really important in one of the steps of the universal health coverage, which is one of the main goals of WHO itself. So that is really important. So thank you so much. And now I would like to give the floor to Dr. Hans, who is a dental doctor from the Tunsberg Medical School. So I would like to ask you this, as an indigenous person from the Norwegian region, so how do you feel and see this perspective of traditional knowledge transfer from one country to another, and also how respecting the elders and respecting the knowledge is important? And yeah.
Okay, all of that, sure.
All of that at once.
Just to give a little bit of context here, because Norway is is a kingdom that houses two people mainly. They houses Norwegians and then an indigenous people called the Sami people. So in that context, I'm just a Norwegian, but I'm also half Thai. And in addition to being a dental doctor, I also am a final year medical student, currently having residency at the local hospital, and I teach at this alternative Indigenous medical school. So I kind of have my foot in a little bit of everything here. So this is very interesting for me in that regard. But to answer your question, what makes Indigenous medicine very, very, very special, as you already heard, is that you have so many factors. You have the culture, the land, the elders, the family, the community, and everything like that. So, for example, in Sami Indigenous medicine, then if you have a minor problem, you go to your family members and receive medicine or treatment from them. Is it a bit more serious, you'll go to someone outside the family, some elders. Just to give an example, the Sami people, they were subjected to 100 years of very aggressive assimilation in Norway and lost a lot of their culture there. So of course that they have a slightly higher distrust value to our mainstream medical healthcare. When we, in terms of transfer protocols of knowledge, we need to have focus on emphasize totally free, what's it called in English? Consent. Yes, totally free consent from the community, the respective realities that share this particular Indigenous medicine branch that you would like to transfer or teach or learn. So there are a lot of factors to take into regard there, but basically everyone needs to agree. You need to have a safeguard on how to distribute this knowledge, who should receive that knowledge, what do you do if that knowledge gets spread out, who owns it, who benefits from it, and so on, such as yoga, which was discussed earlier. Totally went off the rails with that one. And also there we have AI, which might be an issue coming up. So we need to go through all these procedures, create safeguards in order to actually teach other people this. But even if we teach other people this, it will not be the same kind of medicine because it will still be out of context. It will not have the same cultural or local meanings and so on. So you could also always argue, is it the same thing you're teaching or not? So it's very complex in that regard. That's why they often are very restrictive in who to teach it to, and that's why it usually goes throughout the same relative connections. So that's basically that in terms of safeguarding and knowledge transfer in a school context and in a local context. And just to mention it, in Norway, which is a very Euro-Western medical mainstream-oriented country, it's very interesting because in Thailand and also China, traditional medicine is very much implemented into the mainstream healthcare system. So those are some countries that actually did that successfully. And I would wish to see that at least Norway also were more open for the healthcare system to become mature enough to maybe accept Indigenous medicine more and see the culture, especially in the north where most of the Sami people are located. Yeah.
Thank you.
Thank you so much for
You're
that
welcome.
intervention on how. I would like to take this session to our. I would like to thank all our speakers for coming here and speaking on this behalf, and also Miss Jeffrey. He's one of our speakers who we wanted to engage with as well, but he's not here. Anyway, I just want to ask you, other than the Indigenous community, how can the governments be part of this conversation? How can they be involved and make sure that this works properly for everyone? It's a question for everyone, and also after that we will go for the questions online.
I'll just go.
Emma.
Emma.
Thank you. Again, I'm not certain of the kinds of conversation that have happened since before I got here, but my first answer to that is, most importantly, is to acknowledge Indigenous peoples. There are many Indigenous peoples on this planet who are not acknowledged by the countries that they come from. So that's like 2/3 of the 500 million on the planet. So unless that happens, then you can't value the knowledges we bring or even support the things that we are asking for. And so, particularly in a space like this with the WHA, we're looking to member states to really honestly investigate who they have in their populations and how they're representing and supporting us. I'm going to say us. So that's the first thing. Then they have to learn about the things that we're talking about, how they then respect us as populations in our own right, not as minorities, and then how they can work alongside us when thinking about free, prior and informed consent, how we're involved at all levels of decision making and choice over the things that affect our lives. And it sounds very simple the way that I explain it, but it seems very difficult for people to understand that that is not a loss, that is a gain.
Yes.
And so then there is the prioritisation of resource to learn and grow their own capacity about these issues and about us as people, which is led by us in terms of supporting that education. And again, recognising the gentleman on the side who said it's really important to listen to Indigenous peoples, Indigenous expertise and Indigenous knowledge in all the spaces.
Really good points summarised by Emma. It's hard to add to that. I think she's covered everything.
Some examples actually, very Australian examples, unsurprisingly. So I live in a really privileged country, right? Even as Indigenous peoples, we have poorer health outcomes, but compared to the rest of the world. And as Indigenous peoples, I'll give you a bit of context. We actually have Aboriginal community-controlled health services in our country. So there's 240 with about 400 clinics around the country. They cover about 50% of our population. And so these are community run by and for Aboriginal and Torres Strait Islander people. So the members of these communities then form the board. So they are what we call comprehensive primary healthcare services. So they use Western knowledges where, like, you know, if you're HbA1c, go and get tested. But in terms of how we care, so when we're thinking about Indigenous medicines, it is obviously Indigenous medicine. There is traditional medicines. We have nunkeries in those services as well. And sometimes they go into the hospitals, depending where they are. But we also then do use Western medicine within that. But it's the way we care for people within those services, which is driven by a really cultural lens. And the other thing I was going to say in terms of governments, for example, so we get core funding for those services from the government. And so we also have state peak bodies and then a national peak body. I've worked for a couple of them. And governments, and it's not perfect. We still have a lot of fight to do. So don't please think that but the model in and of itself is actually a really good model. And even to the point where some of our individual services are so proactive. So when we're thinking about birthing on country, so that's what we're talking about, reclaiming birthing practices. So our women were banned from birthing on country and using our traditional practices and had to birth at a hospital, but often they weren't actually able to birth in the hospital. They birthed outside the hospital. So just down the road from me is Wominda, an Aboriginal women's service, where all the women got together and created this service because they had to birth outside the hospital and they were not treated very well. And this probably happened up until about the 60s. So we're talking, my mum was born in 54, so we're talking about my mother's generation. So when we think about this, they've actually fought the government to actually allow their Aboriginal health workers to have privileges in the hospital so that our women have continuity of care. And it's the first time the primary health care provider in the country has actually got legislation change to enable our women and our Aboriginal health workers to go into a hospital and birth with our women. So there's that ongoing continuity of care and advocacy. So I think governments, when you've got organised structured systems and you've got a legacy, so the first Aboriginal health service was established in Redford in 1971, and since then, and then you had the second in 1972, and now it's 240. When you actually have organised groups over a long period of time and you have an amenable government, because I appreciate that, you know, sometimes we don't think Australian government's very amenable, but it is compared to other countries. So governments can, and the other thing I'd say is just to Emma's point, resourcing us and then get out of the way and just let us get on with doing the business. Where governments do that, our communities thrive. So
Great.
It's really, really amazing inputs that which can be going in the document as well. Because
I'm so sorry.
no worries. So
There's a question over there.
okay, perfect. Please.
I'm happy to share a little bit of my experiences working with Native American populations.
Can you
So I'm a
introduce
pediatrician. My name is Eileen Zhuang. I'm a pediatrician specializing in infectious diseases and preventive medicine. I have served in the work with the Native population in different capacity in clinical service provision and also working in public health. So our Native American populations, Indians, actually are have a highest 10 times of the risk of getting the what we call invasive pneumococcal diseases. So pneumococcus is the most common pathogens for pneumonia. And so for some reason, they really have, instead of getting just kind of a upper respiratory infection, they tend to get pneumonia and also even meningitis with pneumococcus, 10 times of the risk of the population. So when there was vaccine, pneumococcal polysaccharide vaccine, conjugate vaccine was available, they were the first population to receive those vaccines. So they, and then also to be very responsively, we also go back to study how well they responded to the vaccine. So I serve in the U.S. Centers for Disease Control and Prevention. So I'm a U.S. trained epidemiologist. So we would, after the Native American population have received these vaccines, we'll go back and we'll go through so many service unit, a variety of different indigenous populations, and then understand how well they responded. In those cases for the pneumococcal polysaccharide vaccine, unfortunately, even with a 95% vaccine coverage rate, meaning 95% of them agreed to receive the vaccine, they actually did not respond to the vaccines very well. But they continuously were the one that actually getting one of the best health cares in the U.S. through the Indian Service, IDHA, Indian Health Services, hospitals. They were actually the ones that. Are you aware of it? Are you were?
No, I was just wondering why they didn't respond to the vaccine very well. Does that have something to do with their environments? Or
I think partly. So that was for the initial study. It indicated genetically they didn't, quite respond to that. So it was it's really fascinating. So why were they even more at risk? To start with. So, but there was a lot of different iterations of the vaccines, subsequently as well. Besides the vaccine through the Indian Health Service, they were actually Indian Health Service hospitals throughout a lot of different service units. They were actually staffed by doctors from Johns Hopkins, so they're the best doctors, and so. When I served as the U.S. CDC assignee to the Arizona State Health Department, when I was doing clinical time on the Native American hospital, Fort Defiance Hospital, I also brought a lot of knowledge about what Arizona and also the more remote areas are more susceptible to, such as hantavirus, such as West Niles. And so I did a lot of educations, during the noon conference at night. I even had the chief of surgery coming to the dinner I serve, to get a lot more of these, including emergency preparedness and response. And so those are in different capacities that we also in Arizona headquarters, State Health Department, we actually help to prepare, as a CDC and assignee, help to prepare the state on emergency preparedness and response. And we also train a lot of our tribal staff were actually working in the health department for a long time, but they were not formally trained in epidemiology. We actually had created a certificate, training program, to train them in epidemiology, biostatistics, and their comprehensive kind of provision. So help to solidify their skill set, in not just learning by practical experiences, but they actually got a certificate and solidify their professional skills too. So there was, this may not be sufficient, but this is a segment of what some of the services that was provided to the Native American Indian population in the U.S.
That is really, really something which interesting. So I'm also interested in, like, especially the parts of what happened over there as well. I'll give the floor to.
Thank you. Thank you so much for sharing all of the, insights and the examples. I'm continuously learning through all of these dialogues that makes, it shows the value of dialogue and shared learning. And, one of it's more a question rather than a comment, and it's not necessarily directed at you and it's not meant to put anybody on the spot. Okay. I just want to make that clear. And it's maybe just a broader general question rather than something. I thought it was really interesting how you were talking about one thing that's very important that I think you raised is the exceptional vulnerability of Indigenous populations and the differential health outcomes. And I think that a lot of that actually has to go, and I'm not going to repeat myself because I've already said this before, but a lot of that really originates in the colonial structures that we have imposed on Indigenous populations. But we're not going to go back into that. But one thing that, but the one question that really comes to mind, I thought it was interesting, and I'm not speaking to this example necessarily alone. But you were saying, Indigenous peoples aren't necessarily responding well to those vaccines. And the immediate question that comes to mind to me is, why aren't they responding well? And you're saying, well, and we've provided training, we've provided epidemiological training, and with the best doctors and the best medical doctors and the best schools. And I think that's very valuable. But just in general, I'm just wondering, rather than providing training in itself, just providing training, which sounds like one way, how much of that is actual mutual learning? Because Indigenous peoples hold millennia. Over millennia, they have developed extremely valuable knowledge, as Remy was, also pointing out earlier. And they know a lot about why some things work within their communities and why other things don't. And so I'm just wondering how much of the trainings in general, not necessarily in the example that was shared, is actually about mutual learning and not we are trying to share our very important knowledge with you. But what can we also learn by working with you who to learn from your knowledge and to work together in a much more equitable way. So it's just, a general question, just putting it out there for collective thinking. You wanted to come in? And Emma would like to come in, so I'll pass it.
Thank you, Christina. Look, it's a very good question, and a question that's asked by many people a lot of the time. But the answer is really, truly, it's a societal issue. Society still doesn't see and value Indigenous peoples. As I said before, it's about the acknowledgement of our existence, which then leads into a whole other layer of things, including, the issues with trust that we have with the people around us that are trying to do things not with us, but, making assumptions about what we need and then providing things that aren't actually those things. So again, it's truly about the acknowledgement of the fact that we exist. And so I'm focused really much on this week in regards to that in the conversation around governance, because it is about countries understanding the populations that they have and who they are and how to live in partnership with our peoples in the places where they are in the best way possible, recognising our different knowledge systems. And so recognising also that Jeffrey Roth wasn't able to join us today. And the big part of, the contribution that Jeffrey and my other colleagues from the Indigenous Determinants of Health Alliance have brought into this picture is the Indigenous Determinants of Health definition, and the Indigenous Determinants of Health framework, and the Indigenous Determinants of Health evaluation tool. For this very reason, that we are still working with systems and large communities and social populations that have no idea we exist, they have no idea how to make space for us, and so therefore they don't know how to allow us, and I don't mean allow in that way,
Yeah.
make space for us to be able to live our lives the way we determine based on our worldview. And so when we think about trust, trust is built by people seeing you, acknowledging you, and supporting you to live your life the way that you choose. That does not happen by and large for Indigenous populations. So we can have conversations about specific health issues and different ways of treating things, but actually the issue is how do we treat society so society changes so that we can all be as we choose to be the way that we are born into this world.
Very
Thank you so much for that intervention.
Can I say something?
Yeah, please.
I just want to add what was just said here, underscoring it with a scientific publication.
Yeah.
So in 2025, there was a paper published by Redvers et al.
Yes.
Yes, exactly.
Yes.
And this paper kind of says what you guys said now. The health definition is very different for
Yes.
Indigenous people and the WHO definition. For example, it involves mental health being and spiritual being, and also in according to how the planetary health is, which right now is not good. But also there's this Batwa people who, and they said something interesting here, which I will paraphrase. So they said that when we left the forest, we started suffering and struggling with diseases because we could not get the local medicines we used to get from our forest of birth. We miss our strong medicines that we used to take while in the forest, because every time we would take the medicines, we would be strong and happy. And that's the end of that. So even though we or medicine otherwise think we know the best, that's not necessarily what's best for that particular group. Yeah. That's just what I wanted to say.
Thank you so much.
Great dialogue.
This has been a great conversation going on.
Yeah, I think it's so bad.
The better, I
Okay.
think.
So I would like to open the floor for any questions, so that
Still have time.
yeah, it's like we are almost out of time. I would like to open the floor for any questions, and please go ahead. Okay. Jen.
Okay, thank you so much for your input. It's just so many things that I've learned, and I've been kind of interesting. I've been kind of like, my background is climate change, but also like nutrition and food system, and I've been kind of interviewing adolescents and kind of youth in climate, like making and climate action, but some of them are Indigenous, and I particularly spoke with the people globally, but especially like I spoke with the people from Central America. So like I've learned a lot of like kind of frustration from them, and but also like lots of uplifting, all the energies from them. And they talked about like similar restraints, for example, like language issue. Lots of people not even know what's going on, like when the natural disaster happens, like for instance. But kind of like, so my question is like, right now, it's a globalization, and also like, AI and all the technology, and the world becomes so fast. And if whatever happens in the other side of the world, we know instantly, like, what is the opportunity with the society right now, like the changing to, this topic, and also like to Indigenous community, but also like to, Indigenous medicine and health.
Please. Is it a good? Is it done? Is it that question done?
That was the question. That was a great question.
Thanks.
I would like to give the floor I would like to give the floor to Christina to have an answer on that.
Okay, it's just because I have such a gut reaction to that, right? I hear AI and I'm like, ah, it's so terrifying, and it's terrifying for everyone, but I think it's especially terrifying for Indigenous peoples. And the first thing that really comes to mind is one of the aspects that we touched upon before, and that is safeguards. I believe, I don't remember who's talking about safeguards. I think we all did a little bit, but the importance of really getting the right safeguards in there, because it really raises a lot of questions about what we were talking about in terms of extraction of knowledge. And I think there is a very, very real risk and a very real vulnerability there that we have to. So you're saying, what's the opportunity there? The opportunity there is to create those safeguards and to do that right now, because this is moving so quickly. So I just wanted to start it off with that, because it just set off some alarm bells, in terms of, whoa, I mean, yeah, sure, there can be opportunities with AI, and you were talking also about AI, so I'm sure you've got much more insightful things to share. But I did want to maybe start off the conversation on what safeguards do we need for that, and the real opportunity is to create those that are equitable. I know that we have, for example, the CARE principles that have been developed for I don't know if you're familiar with them, but we have integrated them in the draft framework for their essentially data governance principles that are Indigenous led and created for Indigenous knowledge and Indigenous data. They're not an international legal instrument, but they probably should be. So maybe that is one entry point that we could think of. But anyways.
Of course, I have a comment.
It's important.
I'm not entirely sure what the question was exactly, right? But if we are talking about AI and the opportunity or the safeguards that need to be thought about in place regarding anything to do with that area, what I would say is the opportunity in that is who is building the tools, right? In terms of the empowerment of Indigenous communities to build the tools themselves that are fit for purpose by our people, owned by our people, that get the financial gain to support the communities of our people through building the tools that are going to hold our information and make the determinations for us in these ways, because those things are out there.
Mm-hmm.
So we can be in control of those and
Yes.
control of our own destiny by being supported to be able to build these things from our own worldview.
Thank you so much for that really insightful input for us, because it's something which we are also working on, like as Govardhan, which we are creating a platform where we can link not just Indigenous information but also social a information sharing platform for the entire planet, so that information regarding how people are using plants culturally, medicinally, everything can be shared without any kind of multiple people coming in. It's unifiedly, without too much of the hassle that we had to do our research and stuff. Without that, equally sharing the knowledge and everything like that. So that's something that we're working on as well. So it's really interesting that you had a point on that. Now I would like to give the floor if anyone else. It was a really nice question. Thank you so much. Yeah. Maybe I have to. Yeah. Okay, perfect.
There's a question here.
Yeah, she already had it.
Hello, hi everyone. My name is Grusha, and I just had a few questions. I'll try to be very brief. First for Gokul. So I was curious that how does your app developing right now, right?
It's already out there a little bit.
Okay.
Thank
Congratulations.
you.
And so how does it actually acknowledge the knowledge is of the Indigenous community? How is it working on that level? you can think about it, and I'll have some other questions, so I'll come back to you, not to put you on the
Okay,
spot,
okay.
so you have time to think about it. And also, like, I think it's by WIPO, the Directory of Plants, Medicinal Plants, the IPBES, or is something like that is incorporated into it, or so I'll come back. And then I also had a question for you,
Christina.
Christina.
Yes.
So for the framework that I'm sorry.
Yeah.
So for the framework that you were mentioning, WHO
Yes.
framework, like, is there like aspect on intellectual property?
Oh my God.
And I mean, there's a couple of questions here. Or it's kind of like a collab again with WIPO or something, some sort of those organizations at the regional levels. And then you spoke about the CBD. I did this research with ICCA Consortium, which works on indigenous.
Yes.
Yeah. So we actually analyzed like the gaps of the issues with the CBD, especially after the GBF. And we realized there's a big implementation gap. And we spoke to experts from Canada, India, and also global experts. And so a lot of them were kind of tired. And we also spoke to a lot of indigenous representatives. And a majority of the the voice was that this is, I mean, it's all talk, it's no implementation. So, like, what are we? I mean, I would also like to know about, like, how WHO can help in terms of those implementations that you're talking about in Article 8J, or helping those kind of things. I know that the speaker who was there has left, but on trust was a very huge topic here, and everyone spoke about it. And I stayed with the indigenous community. We actually call Adivasi community in India for around 2 years as part of my fellowship, and I was working with the women self-help groups there. So I documented 198 varieties of medicinal plants for an NGO. And it was very interesting for me to understand that some of these communities had like a bad taste by the industry, where they came and they extracted this knowledge, and I mean, it's being used by pharmaceutical companies, and I mean, there's no credit, there's no benefit sharing. And then there are people from the medicine man who's called the Vaidu in the community. He is very, very, protective of this knowledge, and he has the right to not even share it with his son as a handover of knowledge. And no one can really question that in that community, which is fine. And then, but as a researcher, I feel bad that this kind of knowledge might die and it might not go over generation. But then there's also very bad taste in the community about pharmaceutical coming in and taking this kind of information and using it, and no credits given. So, for me, the trust was a very big question here. Okay, how do we move forward? What's happened, and also build through, I don't know, the mechanisms that you all work on, and you might have better knowledge than most of us. So yeah, and nutrition is so important with the medicine, and like indigenous communities, traditional communities, Adivasi communities, they don't differentiate it. Food is kind of medicine, and with the impacts on biodiversity, it's becoming worse and worse. And we did this challenge, this little activity in a district school, a tribal school, where we told children to go back home and draw 3 plates.
Okay.
And in one plate, like, write or draw what your grandmother used to eat, then your mother used to eat, and then what you are eating. So, and then we realized from the nutritional data that was available through those years that the micronutrients have really declined. And then the plates were entirely different. There were these traditional food and vegetables and preparations in the grandmother's plate. And the mother had like a mix of these new foods, fast foods, but also some like greens from the forest. But the children, they absolutely had nothing of this. And there's like high nutritional deficiency in the area, which then the government is trying to handle it, but by putting in midday meals, but those are foods from outside, which is not really impacting their system. Like she said, like the genes are different, like nutrition, and it's different for each person. It's not one fit for all. So I mean, I'm just giving this as a context, so I can get some answers from you or ideas from you, or your thoughts on it. Sorry.
No, don't be sorry. That was such a rich question. Thank you so much for that. I don't know. I've been writing frantically. I don't even know if I can understand my notes, but hopefully I'm answering some aspects of the question. So I think it began with intellectual property rights, and you were asking if that is at all embedded in the draft WHO framework on respectful engagement with Indigenous peoples. You can't have a framework for respectful engagement without thinking about intellectual property rights or the implications of intellectual property rights. And Rodrigo had talked a little bit about the legislative instruments, and he's actually I know there are language and linguistic barriers, so I know that he would very much like to come in on this point. So hopefully I will do it a little bit of justice. But because he's worked a lot on that particular mechanism, and yes, there is an entire annex that is specifically devoted to international and legal instruments, including those that very specifically address intellectual property rights and the rights of Indigenous peoples with those within those intellectual property rights. So I'm thinking about the WIPO, GRATK. I'm also thinking very much about the Nagoya Protocol on access and benefit sharing of the CBD. And you'd also talked about the CBD. You'd also talked about CBD Article 8J. I didn't have a chance to mention it, but we've had several iterations of the draft WHO framework. And the second iteration of the framework, after we'd received a first round of peer review comments by Indigenous peoples, was actually launched at the first meeting of the subsidiary body on Article 8J of the Convention on Biological Diversity. And it was launched precisely there because the CBD has a long history of engagement with Indigenous peoples, but also to take into account these questions that you raised. So that, yes, it's very much embedded. So I wanted to point that out. The other thing was, how can we help with ensuring, you saying, how can WHO help? Now, I think that WHO can help in multiple ways. One is by creating those partnerships. And those partnerships, for instance, the partnership that we have been fostering and creating with the DOCIP has been very valuable and important to us as a neutral agency that has 5 decades of experience and a very large reach. This kind of thing is extremely helpful, not only to understanding and disseminating the knowledge, but to creating spaces for dialogue, with Indigenous peoples. I think that's another area. So those partnerships are, vitally important. But those partnerships have to be partnerships of equals. This is important too, right? It's not, we're going to have some tokenistic representation of Indigenous peoples around the table, and then we're going to be doing our own thing. No, it's, as Rodrigo was saying earlier, it's a continuous process. It's an ongoing process. It's not once or twice and this meeting and that meeting, and then everything in between, we forget about the importance of that. So how can we help? We can help by creating meaningful partnerships. We can help by creating ourselves those relationships of trust. And those relationships of trust are not built overnight. I've been working in that space for 20 years, and I'm still working hard at it because it's a constant process. And Indigenous peoples have no reason for you to walk into a room and for them to trust you just because you say you're WHO, right? It has to be true. It has to be transparent. And the other point that you had touched upon that I'd really want to, so there's 2 other points you touched upon. I'm looking at my notes here, and you raised a really interesting example where you said, not even this gentleman couldn't even share this knowledge with his son. And that comes back to a very important point that Rodrigo had raised earlier about sacred and secret knowledge. And, sometimes knowledge is not meant to be publicly disseminated. Sometimes we just have to respect the fact that some knowledge is secret, some knowledge is sacred, and it is not meant for international distribution. And so we have to create mechanisms, and that's what we are trying desperately to do. And it's not going to be perfect because no mechanism is perfect, but still, you have to try to create spaces in which we recognize that not all knowledge is meant for public distribution, and to respect that some of that is sacred and is secret. And then the final point that you raised, it was so rich, your intervention, so thank you so much. Oh, and by the way, you mentioned that you'd done some of this work with the ICCA consortium. So I'd like to take a moment to also thank the colleagues, probably also you because it was anonymized, I'm not sure who, but all of the members of the ICCA consortium that have provided peer review comments on the draft framework. So, thank you. Because that does help to strengthen our thinking, and that helps to make this a true product of co-creation. So thank you. That was an aside. But it needs to be acknowledged because, it's not about one voice. It really tries to reflect the 7 sociocultural regions and Indigenous voices in them. But you'd also talked about food systems, and this is such an important point because for so many Indigenous peoples, one of the things that I'm continuously learning is that food is medicine. It's not just about those medicinal plants, but food itself is a source of medicine, is a source of health. And one of the things that we recognize in other work, it's not this work, but in other work that we've done within the eco department around Indigenous and around food systems is called WHO guidance that was released in 2020. Sadly, it was released at the same year as COVID became a thing, so nobody actually read this guidance. But anyway, it's WHO guidance on mainstreaming biodiversity for nutrition and health. And there we talk about the implications of simplified diets. And one of the things that we're also talking about is the importance of traditional food systems. I'm coming back to that. And in some communities, we've learned there's actually a bit of a rejection of those traditional foods because everybody is being bombarded with these food imports that they're forgetting about, the importance of local foods for nutrition and health. And so I think there needs to be a revitalization of those traditional food systems and the knowledge that is associated with it, but also the very real and very tangible health benefits that come from it as well. So thank you for your very multi-pronged question. Hopefully I responded some of it.
Thank you so much, Krishna, for that.
I can be very brief.
We have one more question, so we can just give it to you.
Just to thank you so much. My name is Maria Patina, and I've worked in the space of health financing for almost 20 years. So I come really from a bit different angle, and I have to admit it's my first time in this kind of environment. And I was very curiously listening to you today. These are all things that are very close to my heart, and I'm a big believer in terms of acknowledging different type of medicines along each other and seeing the complementarity between all of them and all they can bring. And it was very interesting to listen about the rights of Indigenous people in kind of benefiting also from the fact that the knowledge comes from them and having the right to self-determine themselves in terms of also how they want to be healed, etc. So thank you so much for that. As I'm coming from the health financing area, to me, when I listen to that, one option for me in terms of how to mainstream this is through the domestic health financing systems, right? Like I think it's a critical issue, and this is where the resourcing could come in for the Indigenous people, but also make it accessible, because I see it also on the other side for people who are not Indigenous but can benefit from that knowledge. And so I was curious to understand how much is being done there. I've worked a lot in health financing for let's say, the kind of Western medicine innovations, but I'd like to see more in this area done for the kind of indigenous medicine area. That's one thing, and I think one element around it, just to highlight, is I think, having worked for it for a long time, what matters a lot is the evidence, and we know how difficult it is to somehow provide that evidence for, you know, the assessment for the domestic health system, to say, well, this is working, we're gonna put money into that, and which brings me back to maybe the methodologies, etc., that are available to create that evidence, right? So I think this is, for me, this connection that I always thought was critical, and I think if you overlay that with the element of, and in this system, how can the indigenous people, they'll benefit from the fact that they allow this knowledge to be accessible to others, is that final element, I think, that you discussed in a lot of detail today. So just to flag those elements that are always on my mind, and I thought that could be, further explored.
Thank you so much for that. Really in the flagging thing that you have been doing. Really appreciate what it was like, how it is really important for having this to be innovative enough, and hopefully we have more sessions on this coming up in Indigenous medicine over here and also going forward. Now I have to give it the
I was also, I have to say, I'm going to recognize I was also being nudged by Rodrigo over here, who's like, yes, financing. I mentioned financing. Yeah, exactly. Where's the question? So he said, please come in. I think he's afraid because of the English, but this is something that he'd raised earlier as well, and something that we're thinking a lot about. And I am so glad you are here. Where are all your colleagues? Please bring them all around the table, because it is exceedingly rare that you have people that are working in health financing that are in these spaces. The first thing we've got to do is bring people like you into these spaces, because I don't remember the exact percentage, and I do not want to I don't want to throw out, throw in there wrong numbers, but I do know one thing. I do know that less than 5%, and it could be 2%. I'm not sure it's less than 2, but in any case, it's a ridiculous amount of health financing actually goes to Indigenous health. And how much of that actually goes to Indigenous peoples? That's something to really think about. So I think we really have to think about that restructuring. And in that same vein, I'm going to take the opportunity to say that definitely less than 2% of public health budgets globally go to prevention. And why is that important? Because we're constantly investing in preparedness and response. What about prevention? That is the most effective option, and that is the one we least invest in. Yet, everybody around the table was talking about how different in the Indigenous understanding of health is. It's so much more holistic, but it's also so much more focused around prevention. Right? It is, and that's something that we lose sight of. It's not about disease and what do we do to combat the disease. It's about health. And so I think that reframing is really essential in those spaces. And yes, financing, because without financing, we can have all the frameworks we want. We can have all of the good intentions that we want around the table. But if the money isn't there to support it, like even when we're creating these frameworks, even when we're talking about these workshops, one of the things that we had to learn is that Indigenous peoples are willingly giving their time to provide some comments, but in some cases it's very difficult for them to do because they are leaving their day-to-day livelihoods to be able to do this. And so I think that financing question is not only important, it's crucial and central, and we can't actually have respectful engagement or equity or meaningful FPIC or anything else without that financing. backing it up. So, all right, I think we exceeded our time, Gokul.
Yeah.
We can stay here for hours talking.
It's like this conversation is not going to end soon. It will be like going forward for in different other contexts as well. For biodiversity, we are having more events happening in biodiversity happening tomorrow on traditional medicine for UNCCD, CBD, and also land degradation things. So how can traditional medicine bridge that gap? And also we have one more event at the 6 p.m. to 7:30 p.m. On youth action for traditional medicine, so which is also happening. So these are the three events that we are focusing on to bridge and bring the people over here. And it's like really hard. We don't have any climate like financing for this, so we don't have any food or any refreshments to give, but still we are managing. And thank you for all the indigenous leaders who came to our event, because they cared. They cared for this event and they wanted to support the youth and also people who are working on this. Thank you so much for all those people who came here to supporting this event, making this happen. Thank you so much, Christina, for even after her
Talking all the
time. Even after her leg has been not properly functioning, it has been injured and it's like too much. So still she made it here, and thank you so much for everyone. Speakers, Rodrigo, and Rodrigo, Emma, Mr. Hans, and
Remy.
also Remy. And all the questions that we got from our guests today, participants. And thank you everyone for being online as well. Thank you so much, everyone. Take care and follow us for more like updates on what's happening to be from the World Health Assembly here.
And thank you, Gokul. Thank you for bringing us together.
Thank you very much, guys. Okay, perfect. Thank you so much, everyone. Bye. Take care. Thank you.
Thank you.